Our next story comes from India. It is witnessing an uptick in COVID-19 cases. After months of lying dormant, the Wuhan virus seems to be on the prowl once again. The numbers tell you the story. In the last 24 hours, India has logged 1,573 fresh COVID-19 cases. This has taken the active cases tally to 10,981. During the same period, 4 new deaths have been recorded, all in Kerala. If I speak of the weekly test positivity rate, it has increased to 32% from 10% last week. This is a 3.5-fold rise in 2 weeks. Is this unusual? It is. Look at this graph. It depicts the daily case count since the beginning of this year. Throughout January and February, the cases remained static. Not once did they cross 500. But ever since March started, the infections have steadily risen. On the 12th of March, India recorded 524 cases. On the 19th of March, it recorded 1,071 cases. On the 23rd of March, there were 1,300 fresh cases. And in the last 24 hours, there were 1,573 fresh COVID-19 cases. Next question, where is the infection spreading? This map gives you a better idea. The biggest spike is in Delhi, Kerala, Maharashtra and Gujarat. Now, here's the thing. I know these numbers don't sound like much, given the massive COVID-19 waves that we have witnessed in the past. But that does not mean we give in to complacency. If the last 2 years have taught us anything, it's this. Viruses are unpredictable. They keep evolving and mutating, especially the killer from Wuhan. Remember, since December 2020, it has transformed into multiple variants: Alpha, Beta, Gamma, Delta, each variant deadlier than the previous one. So every small spike in infections matters. Also, no one wants to see the terror of a lockdown making a comeback. The question is, how serious are these cases really? Well, most of them are not severe. According to the doctors, the new patients are not showing any major symptoms. Listen into this.
Their existing cases of COVID-19 are not that symptomatic, and among the rising cases, some are incidental too. For instance, a patient was admitted to our hospital, but she was not symptomatic for coronavirus. She fainted owing to some other health factors, and when she was getting prepared to be put on ventilation, she tested positive for coronavirus.
So most of the cases are asymptomatic, but the fact is they are still growing. So what is being done about this? Well, the government is clearly on the go. Last week, the Prime Minister of India convened a high-level meeting of the COVID-19 task force. This was the first time this year that such a meeting was convened. The aim was to review the COVID-19 situation and preparedness. And what was the outcome of the meeting? Reports say the government decided to enhance genome sequencing of the positive samples. And that's not all. The government is also planning a nationwide mock drill to take stock of the COVID-19 preparedness at the hospitals. These drills will be held on the 10th and the 11th of April. The aim will be to check the availability of medicines, hospital beds, medical equipment. Simply put, India is not taking any chances. It is prepared for any major spike, which right now seems highly unlikely. Health experts are saying this. They say the change in weather in the recent days, to shift from heat wave-like conditions to incessant rainfall in the last 2 weeks, which saw the mercury dip heavily, could explain the growing cases. And this change has contributed to an ideal environment for viruses to thrive and infect more people than they usually do. We have been telling you how the H3N2 virus has been spreading in the country. The virus is a type of influenza virus that can cause respiratory illness in humans, because the virus and the Wuhan virus share symptoms like fever, cough, body ache. it can be difficult to differentiate between COVID-19 and flu caused by the H3N2 virus without a COVID-19 test. As of last week, there have been around 1,317 H3N2 cases. 19 of these cases required ICU admission. Doctors say most of them were linked to the changing weather. And is it the same story with the Wuhan virus? So far, it seems to be. But like they say, prevention is better than cure. So the right thing to do right now is to draw the right lessons from the past and exercise caution every time we step out. Remember also to do your bit to protect others if you are unwell. Do not go to work if you are experiencing symptoms. Cover your mouth when coughing or sneezing. Stay safe and keep others safe. WION now available in your country. Download the app now. Get all the updates on the move.